across 9 different metropolitan areas to see if they could predict heroin-related admissions into emergency departments using opioid-related internet searches. Using Google Trends, they were able to amass a large amount of real-time data for specific keywords entered into the search bar. They found a strong correlation between specific words such as methadone and brown sugar and an increase in heroin-related admissions. They saw the same correlation in the opposite direction, as cities with lower opioid search volume had less heroin-related admissions. Therefore, this study proves that the validity and the usefulness of internet search data and potentially social data. In class, we have discussed social data and its role in predicting opioid and disease outbreak across the U.S. While this may be slightly different, it is along the same lines. I personally love the idea of putting some of those rather frustrating posts into good use, especially if they can be used to dampen or prevent an outbreak.
Looking at the study conclusions, we can see that internet search data can enable low cost and early detection of public health events. Using this internet search data is something that's very accessible and allows us to provide more real-time data, therefore not having to use outdated data, which may not be as relevant to our research. Some limitations, however, do exist to using Google search data because there's common sample bias because not everyone uses Google as their search engine. And additionally, there's a lack of context when we use keywords from search data. Whereas other social media such as Twitter, we can analyze the context within the words within the tweet. This comes into play when we look at identifying the keywords of brown sugar, as this study could not differentiate between the brown sugar used for baking, whereas brown sugar referring to opioid use. Another limitation that we can see is that we need to incorporate both urban and non-urban areas into this data, which was something that was limited. However, looking at the opportunities, there's a lot that can be done with the use of internet search data.
Through the second article, I learned a clear definition of predictive analytics, which is using electronic algorithms to predict future events. The author argues that big data systems and predictive analytics have the potential to improve healthcare because doctors will be able to use this data to better understand their patients and to provide more accurate diagnoses and prognoses. The author also says that there is potential for great harm from PA. However, he does not mention what these great harms are. While I would have wanted the author to elaborate on the negatives of PA in clinical care, I agree with him that ethics and individualized care are important considerations when using and creating this technology. Additionally, different PA algorithms consider and prioritize different factors, such as cost, workflow, and patient outcomes. So I agree with the author that doctors who use PA should be aware of these factors and how these factors are considered by the algorithms. Another thing to consider about this article is that the author is an MD himself, so I think this fact might have affected his opinion that PA technology cannot be depended on to provide the best advice for care, and his opinion that when PA results and the physician advice differ, the physician is ultimately right. However, I think that even if the physician disagrees with the algorithm's conclusion, they should still investigate why the system came to that conclusion.
This article does well to emphasize the need for transparency in the development of models that use predictive analytics, and that this transparency is available to all parties, especially patients and doctors. Transparency is important as it can aid in advancing health equanimity. Part of that concern is that the sample selection is done in a manner that best reflects the population. Utilizing inaccurate sample selection methods could result in exacerbating extant health disparities. From my perspective, the potential benefits of predictive analytics are quite alluring, but I am skeptical of this new technology. Much of my skepticism comes from the inadequate solutions for many known health disparities. For instance, our country has the highest maternal mortality rate, and if you are amongst industrialized nations, and if you're a black woman, you are 3 to 4 times more likely to die from pregnancy-related causes. As of yet, there is no satisfactory solution for this health disparity, so I would be wary of such a hypothetical model. Fortunately, this article assuaged some of those concerns by drawing fact to the irreplaceable role that doctors have in utilizing evidence-based decision-making. As long as physicians maintain their role in doing what's best for their patients, I have faith that these potential harms can be avoided.